Fear of contracting a bloodborne disease such as AIDS has caused some people to overreact, leading to awkward and embarrassing situations in the work environment. The chances of contracting a bloodborne disease in the work environment are minimal. Your job may require exposure to blood on a regular basis, or you may be exposed only in rare instances. But because of the potential consequences of bloodborne pathogens, it's important that everyone in the workplace has an understanding of the diseases and how they can be transmitted. In this program, you'll learn the diseases associated with bloodborne pathogens and their respective symptoms, how these diseases can and cannot be transmitted in the workplace, proper procedures to prevent exposure, including safe work practices, engineering controls and personal protective equipment, and steps to take if an exposure occurs. Bloodborne pathogens are microorganisms that cause disease. They're found in blood and blood products such as semen, vaginal secretions, breast milk, and other bodily fluids. They're also present in tissue cultures, organ cultures, and experimental animals. The two most prevalent bloodborne diseases are hepatitis B and the human immunodeficiency virus, HIV. Although HIV is more publicized, the greatest occurrence in the work environment is posed by hepatitis B. Hepatitis B is an inflammation of the liver caused by a virus. Reactions to the virus differ from mild symptoms that resemble the flu to more severe symptoms such as lack of appetite, dark urine, jaundice, nausea, vomiting, and diarrhea. About 1/3 of those infected with the virus show no symptoms but become carriers and are more susceptible to other liver diseases. The HIV virus progresses into AIDS, initially developing flu-like conditions such as chronic fatigue and fevers. The virus attacks the body's immune system, making the AIDS patient susceptible to many types of diseases, including forms of cancer and pneumonia. Situations in which you could be exposed are rare, but must be understood. Do any of these following scenes present a situation in which an infection from a bloodborne pathogen could occur? Could this worker be exposed? Is this a means of transmission? Hepatitis B and HIV can only be transmitted if the source blood is infected, and that blood or other potentially infected material finds a direct route of entry into the body. These routes of entry include breaks in the skin, such as a cut, scrape, dermatitis, or acne, splashes into body openings, such as the eyes, mouth, and nose, or penetration into the skin by a sharp contaminated object, referred to as parenteral exposure. Hepatitis B has a much higher concentrate of viruses per milliliter of blood than HIV, therefore is more contagious. For example, the risk of acquiring hepatitis B from a needle stick injury with hepatitis B blood is 6 to 30%. Acquiring HIV from a needle stick with HIV is less than 1%. The increasing incidence of AIDS has caused fears that have developed into misconceptions of the disease. The HIV virus is not transmitted by casual skin contact. It cannot be spread by the sharing of food, drinking glasses, or towels. It is not transmitted by coughing or sneezing. Tears, perspiration, and saliva can carry small traces of the HIV virus, but not enough to cause infection if transmitted. It cannot be transmitted by sharing protective equipment, including respirators. The HIV virus cannot be spread by insects or animals. In the first scenario, there was an exposure if the blood-stained broken glass penetrated through the glove and into her skin. The chance of an infection occurring is slight, but the potential does exist. In the second scene, there was no chance of transmission. Bloodborne pathogens cannot be passed on by sharing protective equipment. Because the lab technician did not wash her hands before rubbing her eye, there is a chance of transmission if the source blood is contaminated. Situations in which you could be infected if the proper precautions are not taken include a puncture into your skin by picking up contaminated glass or other sharp objects, touching blood on a tool or machinery with exposed skin that has dermatitis or cuts, contact with improperly disposed of contaminated material, or assisting an injured coworker without proper protection. The incidents in which exposure could occur can be eliminated by following safe work practices. This includes utilizing engineering controls, following safe housekeeping procedures and personal hygiene, and the use of the proper protective equipment. The safest approach to handling of blood or other potentially infectious material is to take universal precautions. This means that all blood is treated as if it were infectious. For instance, first aid or emergency response teams must wear gloves to prevent exposure with all patients. Protective equipment acts as a barrier between infectious substances and potential routes of entry. Gloves must be worn when there is any hand contact with blood. Before putting on the glove, check for holes, tears, or punctures. When removing potentially contaminated gloves, roll up the end of the glove inside out. Once the other glove is removed, there's a clean surface for the unprotected hand to remove the contaminated glove. Hands must be washed immediately after removing gloves. Never wash or decontaminate disposable gloves for reuse. Utility gloves may be decontaminated and used again. Do not reuse if they are cracked, torn, peeling, or punctured. Hyperallergenic gloves, glove liners, and powderless gloves are available if you're allergic to the gloves normally provided. Gowns, aprons, or lab coats must be worn in more extreme situations. Eye protection is needed whenever there's a possibility of splashing or spraying of blood. Pocket respirators or resuscitation bags must be available to emergency responders to protect against fluids that may possibly be projected in a resuscitation emergency. Spills of blood or other potentially contaminated materials must be cleaned up immediately. When cleaning up a spill, wear full personal protective equipment to prevent contact of infectious material with any part of your body. A 10-to-1 ratio of sodium hypochlorite, normal household bleach, mixed with water will effectively decontaminate the area. Make sure the cleaning is thorough. Check for any tools or other materials for possible blood contamination. The greatest threat of exposure to bloodborne pathogens in the work environment comes from a puncture into the skin from contaminated sharp objects. Always use mechanical means such as a broom and dustpan or tongs for picking up broken glass. Bring the trash receptacle toward the broken objects instead of carrying broken glass across the room. Needles or other sharp objects must be placed into puncture-resistant, leak-proof sharps containers. Needles should not be bent, recapped, sheared, or removed. Do not overfill containers with sharp objects. Someone could be punctured by reaching in. Vaccinations are available that will prevent hepatitis B. The vaccinations are given in 3 doses over a 6-month period and have proven to be 90% effective. If you are exposed to blood or other potentially infectious material on a regular basis, this is made available to you. If an exposure occurs, immediately wash out the potentially infected area. Then report the incident to the proper personnel. A blood test can then be performed to determine if an infection has occurred. All medical records are kept confidential and will not be made available to the employer. If you have not been immunized for hepatitis B, you can receive it at that point. Occupational exposure to bloodborne pathogens is rare. Although some jobs have a greater chance of exposure than others, everyone must understand the diseases and the modes of transmission. One exposure could lead to a life-threatening disease. Recognize situations in your work environment in which exposure could occur. Follow the established work procedures at your company. Know when and how to use the proper personal protective equipment, and use universal precautions. By understanding bloodborne pathogens, you can achieve a balance between overreacting and developing the proper respect that'll prevent occupational exposure to bloodborne pathogens.